Hello, my name is FATIN HANANI. I will present the introduction for our presentation. An anesthesiologist is a doctor who administers anesthesia. Their areas of competence include administering anesthesia and developing anesthesia programs. In order to ensure that patients have a safe surgery, an anesthesiologist assists. This treatment may involve general anesthesia, which is putting the patient to sleep, sedation using drugs to make the patient relaxed or unconscious, or regional anesthesia using an injection of a local anesthetic close to the area of the body being operated on to numb it. The anesthesiologist will also discuss the surgery with the patients and the patient's relative and assist in creating a care plan. Their main objective is to make sure the patient has a successful procedure. In order to optimize the patient's medical condition, surgery may be delayed or cancelled if they are sick. The likelihood of putting the patient at risk is reduced as a result. 196 hospitals offered anesthesiology services, 83 of which were governmental hospitals and 113 were private hospitals. The poll received responses from 64.6% of private hospitals and 100% of public hospitals. 681 anesthesiologists were employed in total, or 1 for every 42,000 persons, which is 0.24 for 10,000 population. This ratio was lower than that of wealthy countries like the United Kingdom, which is 1 for 5,000. The ratio of anesthesiologists to surgeon was 1 for 4, which is significantly less than the suggested ratio of 1 for 33. Government employment accounted for 57% of anesthesia experts in Malaysia. 50 to 60 new anesthesiologists will graduate every 4 years, despite the fact that there were 292 anesthesiologists, 292 anesthesiology trainees, and 41 subspecialty trainees in 2010.
Hello, my name is QISTINA ALYA. I am going to present about anesthesiologist, health workforce supply and trend. As you can see, this is the anesthesiologist distribution in Malaysia in year 2013. Start off with Perlis and Kedah, there were 4 and 31 anesthesiologists respectively. During the year 2010, there were 5 anesthesiologists and 4 during 2011 in Perlis. While in Kedah, there were 27 anesthesiologists for the year 2010 and 2011. In Penang, there were 54 and 55 anesthesiologists respectively for the year 2010 and 2011. However, there was an increase in 2013, making the anesthesiologists in Penang to rise to 64. Perak, on the other hand, had 53 anesthesiologists in 2010 and 52 anesthesiologists in both 2011 and 2013. Selangor, Federal Territory Putrajaya and Kuala Lumpur had the highest number of anesthesiologists. During 2010, there were 305 anesthesiologists, 315 for 2011, and 343 anesthesiologists during 2013. For Negeri Sembilan, the number of anesthesiologists rose from 19 to 20 to 25 people respectively for the year 2010, 2011, and 2013. In Malacca, the anesthesiologists in 2010 were 28, while 27 was recorded in 2011. The number went up to 30 anesthesiologists in year 2013. Johor held the second place in having the highest number of anesthesiologists. In year 2010 and 2011, there were 60 anesthesiologists, while 62 in the year 2013. For Peninsula East Coast, in Pahang, there were 23 anesthesiologists in year 2010 and 2011, while 26 anesthesiologists was recorded in 2013. Terengganu had constant number of anesthesiologists, which was 13 for 2 years. During 2013, it was recorded that there was 19 anesthesiologists. Kelantan had 28, 29, and 30 anesthesiologists respectively during the year 2010, 2011, and 2013. For Sarawak, there were decreasing the number of anesthesiologists. During 2010, there were 35 anesthesiologists, while in 2011, and 2013 there were only 32 and 33 anesthesiologists respectively. Lastly, in Sabah, they had 26 anesthesiologists during 2010 and 2011, while 33 anesthesiologists in year 2013. In conclusion, the trend of anesthesiologists over these few years had been increasing. Moving on to the anesthesiologist density in 2018, the chart shows the density for anesthesiologists for every 10,000 population. In Peninsula West Coast, there were 0.39% anesthesiologists for every 10,000 population, while in Peninsula East Coast, there were 0.23% of anesthesiologists for every 10,000 population. In Sabah and Labuan Federal Territory, only 0.15% was recorded for anesthesiologist density in this place. Finally, the density was 0.18% in Sarawak for every 10,000 population.
Hi, my name is ATIFAH NADHRAH, and I will be presenting the issues of anesthesiology supply in Malaysia. Firstly, Malaysia has faced significant shortages of anesthesiologists, which also includes them to have enough training, competence and adequate experience in medical field. Being an anesthesiologist can be taken by two paths. Either way, the path of being an anesthesiologist is a long journey, which takes about more than a decade, by average 12 to 15 years. In Malaysia, medical students mostly take either FCAI or MMAD. FCAI stands for Fellowship of College of Anaesthetic of Ireland. Meanwhile, MMAD is Master of Medicine. Additionally, it is predicted that if present training capacity is not enforced, the lack of expert anesthesiologists, about 645 people, and subspecialists, about 87 people, will not be resolved for more than 10 years. Secondly, the burnout among anesthesiologists is an alarming issue for healthcare system. Even though anesthesiology is one of the most demanding medical specialties, it exposes doctors to pressured tasks and stressful situations like regularly handling life-threatening scenes and frequent on-calls. Furthermore, the work schedule may be perceived as more demanding than those of the other medical disciplines because tasks need working late shift, weekends, and social gatherings. Although a thorough review have not been done, it will be not surprising to learn that anesthesiologists have high rate of burnout. Thirdly, a risky handling of anesthesia to patient leads to many health complications. Anesthesiologists must take a meticulous practice of anesthesia at optimum level to reduce the possibility of infection risk among patients. Further problems including the time and dose of such exposure, in addition to the issue of differences in the target group involved, need to be handled.
Hi, my name is AQILAH BATRISYIA binti ANUAR. Okay, now we move on the recommendation. As you can see in this slide, it shows that Malaysia is shortage of anesthesiologists. For the recommendation, the future anesthesiologists are expected to be able to provide treatment for patients in a variety of settings, including the operating room, critical care unit, and emergency room. It is important to define the specific clinical abilities that this doctor will possess. Moreover, if the present training capacity is not enhanced, it is predicted to take more than 10 years to eliminate the shortfall of 645 anesthesiologists by the year 2025. The Ministry of Health aiming for a ratio equivalent to that Canada, which will need twice as many anesthetists as are needed. The total annual outputs of roughly 20 until 30 anesthetists from our three significant institution specialty program. To conclude, the Ministry Health of Malaysia will improve and increase the number of anesthesiologists in Malaysia. For the second recommendation, which is about issue burnout among anesthesiologists. This is the method of level of physical activity, which is to measure the volume of activities. This is to measure how many move about or how many metabolic equivalents MET burn off within a specific time. An activity MET score is multiplied by the time it is complete to get a MET minute. Calculating your MET minutes for the week is simple as multiplying your MET level by the number of minutes you spending exercising each day. Numerous studies have shown exercise health benefits now. Mounting evidence suggests it may also help anesthesiologists deal with stress and avoid burnout. Lastly, the recommendation is based on the issue lack of medication. Several steps are being taken and will be taken by the medical program in improving the quality of service medicine provided by Ministry of Health Hospital. In addition to improving the infrastructure and human resource development efforts, it is important that the system used for medical service operation be adjusted and improving from time to time. The use of system and more systematic work processes can ensure that existing resources are used optimally and more effectively. It's admirable that the Malaysian Ministry of Health has moved quickly to provide pharmaceutical stop loss to private health institutions. That's all for the recommendation. Thank you.
As a conclusion, anesthesiologists are not employed in great numbers due to the reasons indicated in the issue part of the study. What's more concerning is that Malaysia's medical industry will incur losses and be detested by industrialized countries if this is not rectified quickly. Despite a minor improvement, data collected indicate that the field of anesthesiology is not very popular. This illustrates that the Malaysians today only work in surgical specialties and other highly sought after medical sectors. Every hospital needs an anesthesiologist in order to increase the effectiveness of the Malaysian healthcare sector and progress the area of medical in Malaysia. This problem needs to concern the government. In reality, it may make sure that people are protected and cared for well so that they can contribute to the growth of the country. In order to progress anesthesiologists and guarantee that future clients can benefit from their services, the government must also take initiatives to spark young Malaysians' interest in the area of anesthesia and encourage them to seek professions in it.